What if I told you that in the United States right now, millions of people are being misdiagnosed with the wrong autoimmune disease, because Sjogren Syndrome, rheumatoid arthritis, and multiple sclerosis all start with the same symptoms. Joint pain, brain fog, fatigue, nerve tingling. You think it's RA, your doctor says it's anxiety, but it turns out it's something else entirely, and it's getting worse. The scary part? Even top US clinics miss it. Because these three conditions mimic each other so closely, they get confused every single day, even by specialists. That's why in this video, I'll walk you through a symptom-by-symptom breakdown of all three, so you know exactly what's what, and what to ask for before your next appointment. I've pulled real patient stories, real US data, and expert-backed diagnostic clues to help you figure out what your symptoms are really telling you. And if you want my free downloadable symptom map, just type symptom map in the comments. I'll heart your comment and drop the link. Imagine this, you live in the US, you're 48, and your body's been quietly falling apart for months. Your joints ache every morning. Your legs feel heavy by 2 p.m. You've started forgetting words, and your feet burn at night like they've touched a hot stove. So you go to your doctor, expecting answers. They run some basic labs, maybe an ANA or rheumatoid factor. Everything looks normal. And then comes the classic line. You're just getting older. Maybe it's early arthritis. Let's wait and see. But 6 months later, you're tripping over your own feet. Your vision blurs. You feel electric zaps running down your spine. And suddenly, you're being tested for multiple sclerosis. Except that's only half the story. Because what they missed was Sjogren Syndrome, a condition that's quietly damaging your nerves, your joints, your tear glands, even your brain. And here's the shocking part. Up to 50% of Sjogren's patients in the US are never diagnosed, or are misdiagnosed as having RA or MS. This is what I call the overlap trap, and it's one of the biggest blind spots in autoimmune medicine right now. Why? Because Sjogren's, RA, and MS don't play fair. They all attack the immune system, but they do it differently. Still, the early symptoms? They look almost identical. Fatigue, joint swelling, brain fog, nerve pain, dry eyes, trouble walking, pins and needles. If you have just 2 or 3 of these, any of the 3 diseases could be to blame. And that's the trap, because most doctors only treat what they're trained to recognize. Rheumatologists see inflammation and think RA. Neurologists see tingling and think MS. But nobody checks for Sjogren's, because it hides, overlaps, and doesn't always show up on blood work. That's why so many people bounce from specialist to specialist, with a bag full of pills, but no clear diagnosis. So in the next chapter, we'll break the pattern. I'll show you the 5 symptoms that all 3 diseases share, and then we'll start pulling them apart, layer by layer, so you can finally see what doctors often miss. Here's the truth no one's saying. Sjogren's, rheumatoid arthritis, and multiple sclerosis can all start with the exact same 5 symptoms. And that's why people in the US are getting slapped with the wrong diagnosis, sometimes for years. Let's break them down, side by side. You're going to want to listen closely, because each of these symptoms comes with a twist. Symptom 1, crushing fatigue. We're not talking I need a nap tired. This is whole body, bone-deep exhaustion. RA fatigue hits during flare-ups. MS fatigue often hits out of nowhere, even without inflammation. And Sjogren's? It creates immune exhaustion and sleep fragmentation. Even if you sleep 9 hours, you wake up feeling like you got hit by a truck. Doctors wave this off all the time in the US, especially for women over 40. They'll call it stress, or menopause, or depression. But this kind of fatigue is a sign the immune system is attacking something. And that something is you. Symptom 2, joint pain. All 3 diseases can cause joint pain, but here's the catch. I usually starts with small joint stiffness, hands, wrists, ankles, and it's symmetrical. Both sides of the body. Swollen. Warm. Pain that lasts longer than 45 minutes in the morning. Sjogren's joint pain? Less swelling, more aching. It can be random, move around, flare with dryness or after eating inflammatory foods. And MS? Joint pain is usually not from the joints themselves, it's referred pain. From nerve compression, spinal misfires, or muscle weakness. So if you've got joint pain, but the swelling doesn't match RA, and the scans are clean, that's a red flag. It might not be your joints, it might be your nerves. Symptom 3, brain fog and memory trouble. Here's where people really get dismissed. You walk into a doctor's office in the US and say, "I'm forgetting words. I can't focus. I lose my train of thought mid-sentence." And they look at you like you're overreacting. But this isn't just stress. Sjogren's can cause neuroinflammation, reducing blood flow to your brain, especially the frontal lobe. MS damages the myelin around brain neurons directly. And RA can release inflammatory cytokines that bypass the blood-brain barrier and disrupt cognition. Same symptom. 3 totally different root causes. That's why if you're feeling off, like your brain isn't yours anymore, you need to dig deeper than just a mental health referral. Symptom 4, numbness, tingling, burning sensations. This one throws doctors off every time. MS causes numbness and tingling due to spinal cord lesions or optic nerve inflammation. Sjogren's causes small fiber neuropathy, a burning, buzzing, electric feeling that hits your feet, hands, face, or even your scalp. RA can compress nerves near inflamed joints, especially in the hands, like carpal tunnel syndrome. But here's the problem. Most US doctors don't test for small fiber neuropathy, and they don't order MRIs until late. So people walk around with idiopathic nerve pain, which is just a fancy way of saying, we don't know why you're suffering. Symptom 5, muscle weakness or trouble walking. All 3 can affect your ability to move. But how it happens? That's the giveaway. With MS, you might feel like one leg is dragging, or you trip over flat ground. It's subtle at first, until it's not. Sjogren's can affect motor nerves, too, especially if it progresses into demyelinating neuropathy, which looks almost identical to MS on the surface. And with RA, it's more about pain-induced weakness. The joint hurts too much to move normally, so your muscles weaken from disuse. So if you're walking funny, limping, or losing grip strength, but your X-rays and MRIs are normal, don't let them gaslight you. Weakness without cause is a diagnostic clue, not a dead end. And here's the punchline. Most people watching this video have 2 or more of these symptoms right now. But they are being treated for just one condition, or none at all. Coming next, we'll flip the script. I'll show you the one symptom that almost always separates RA from Sjogren's. Then the next one that helps rule in MS. And finally, the rare clue that reveals if you're dealing with 2 at once. If you saw yourself in those last 5 symptoms, fatigue, joint pain, nerve glitches, you're not alone. That overlap is exactly why so many people in the US are walking around misdiagnosed. But here's where things start to split. Because even though these diseases can look alike early on, they eventually leave different fingerprints on the body. And once you know what to look for, the confusion starts to clear. Let's talk about the 3 biggest symptom clues that help separate them. 1 for rheumatoid arthritis, 1 for multiple sclerosis, and 1 for Sjögren syndrome. RAS signature, symmetry plus swelling plus stiffness. If your joint pain is symmetrical, both hands, both knees, both wrists, and if your joints feel stiff for over 45 minutes in the morning, you're staring RA in the face. It's not vague. It's precise. Pain shows up on both sides of the body, especially in the small joints. You may even see swelling or redness. Blood markers like rheumatoid factor or anti-ccp antibodies often confirm it, but here's the kicker. About 1 in 5 RA patients in the US test negative. That's why the pattern matters more than the paper. MS's red flag, vision trouble plus electric shocks. This is the one most people miss. If you've had blurry vision in one eye, pain when moving your eyes, or colors that suddenly seem dull, you might have had optic neuritis, an early sign of MS. Another big giveaway? That strange electric zap down your spine when you tilt your head, called Lermit sign. Almost no one with RA or Sjogren's experiences that. If these symptoms sound familiar, you need an MRI of your brain and spinal cord with contrast. Don't wait months for a referral. Comment MS scan if this hit home. I'll heart your comment and send you a scan checklist and exact phrases to use with your neurologist. Sjogren's clue, dryness plus cavities plus burning tongue. This is the clue no one talks about. If your mouth constantly feels like sandpaper, if you wake up choking on dryness, or if your tongue feels like it's on fire, don't ignore it. That's more than discomfort, it's a sign your glands are under autoimmune attack. And if you've had multiple cavities, gum issues, or dental infections despite good hygiene, that's a classic Sjogren signature. The problem? In the US, many doctors won't test for Sjogren's unless you complain about dry eyes first. And by then, your nerves may already be damaged. Sjogren's can look like MS, especially when it causes small fiber or autonomic nerve damage. But it often doesn't show up on the same scans. That's the danger. So let me break it down real simple for you. If your joints are stiff and swollen on both sides of your body, like both hands, both knees, and especially if the stiffness is worst in the morning, that's classic rheumatoid arthritis. If you've been dealing with blurred vision, sudden eye pain, weird electric zaps down your spine, or you've been tripping more than usual, that's pointing toward multiple sclerosis. But if what's bugging you the most is this deep, relentless dryness, like your mouth feels like chalk, your tongue burns, your teeth keep breaking down, and none of the scans show why your nerves hurt, that's a big red flag for Sjogren syndrome. Getting this right matters. The wrong label leads to the wrong meds, the wrong treatment, and years of unnecessary damage. Coming up next, I'll walk you through the nerve test that separates MS from Sjogren's, especially when the brain MRI is normal, but the pain keeps getting worse. So here's the million-dollar question. What do you do when your nerves are clearly misfiring, but your MRI is clean, your blood work is normal, and the specialist shrugs? That's where this next piece can change everything. It's called a skin punch biopsy, and in the US, almost nobody is told about it. The problem with standard nerve tests. Let's say you've got burning feet, buzzing in your legs, or your hands feel numb when you're not even sleeping on them. You go to the neurologist. They order an EMG or nerve conduction study. You lie on the table, wires attached, and they zap your muscles. Test comes back normal. They say, you're fine. Maybe it's anxiety. But here's the truth. Those tests only check your large fibers. The small fibers, the ones responsible for burning, stinging, and autonomic dysfunction, don't show up on EMGs. And this is where Sjogren's and MS start to diverge. Small fiber neuropathy, the overlooked clue. Small fiber neuropathy is one of the most common neurological complications of Sjogren syndrome, especially in the US, yet it's rarely tested for. It causes all the weird stuff. Burning hands and feet. Pins and needles in random spots. Heat intolerance. Resting heart rate too high. Dizziness when standing. Nerve pain with no MRI findings. MS can cause nerve damage too, but usually with lesions on an MRI. Sjogren's, on the other hand, can cause severe nerve dysfunction with completely normal imaging, especially early on. That's why so many people with Sjogren's are misdiagnosed with MS, or told it's idiopathic neuropathy and left to suffer without treatment. The test that can expose the truth. The test you need is called a skin punch biopsy. It's quick, low risk, and done right in a clinic. They take a tiny sample of skin, usually from your calf or thigh, and measure the density of your small nerve fibers. If the count is too low, it confirms small fiber neuropathy, which finally gives doctors something objective to work with. And here's the kicker. If your skin biopsy shows damage, but your MRI is clean, that leans heavily away from MS and strongly toward Sjogren's or another autoimmune cause. This single test has helped thousands of people across the US get proper treatment, after years of being dismissed. If you've had nerve symptoms with normal scans and normal EMG, drop a comment that says NeuroMap, and I'll send you a free checklist with the exact test names, what to ask for, and how to talk to your doctor without being ignored. Up next, we're going to talk about the one blood test that links all three conditions, but doctors often skip it, even in major US hospitals. And it might be the missing piece in your diagnosis. Now here's the part that drives people crazy. You go to your doctor. You've got pain, fatigue, maybe even numbness or blurry vision. So they order some blood work, maybe a CBC, an ANA, or basic inflammatory markers. And everything comes back normal. So they tell you, there's nothing wrong, or let's wait and see. But what they probably didn't run, is the test that could have changed your entire diagnosis. The test they skip, anti-ccp, Rho, and anti-ccp, La. These are autoantibodies, immune system markers that show up most often in Sjogren syndrome, but can also appear in RA and MS overlap cases. They don't show up on a basic ANA panel. You have to ask for them directly. In fact, in a large US study of Sjogren's patients, over 70% of those with nerve damage tested positive for SSA or SSB, but half had never been tested before their diagnosis. And it gets worse. Some US labs don't even include SSA, SSB unless you specifically check a box or write it in. Why this matters for all three. In RA, SSA positivity might indicate overlapping autoimmune syndromes. It can influence treatment decisions. In MS, SSA doesn't confirm it, but if you have nerve symptoms with SSA, it might actually be Sjogrens, not MS. And in Sjogrens, it's often the only clue doctors get in the early stages, especially before dryness shows up. This is why some people bounce between neurologists, rheumatologists, and ENTs for years, getting fragments of their diagnosis, but never the full picture. If you've had a full blood panel but no one checked for SSA or SSB, go back and look at your labs. And if you don't have access, just type SSA check in the comments and I'll reply with a free list of the exact blood tests to request, so you don't get brushed off again. Coming up, we're going to tackle something even more personal. When two of these diseases show up in the same body, and how that changes everything, including how you're treated. Let's talk about something most doctors don't even want to bring up. What happens when you don't just have one of these diseases, RA, MS, or Sjogrens, but two at the same time? Because it happens. A lot more than people think. And it's not just rare cases. This is showing up in real patients across the US, right now. A real scenario that's happening right now. Picture this. A 52-year-old woman from Ohio is diagnosed with rheumatoid arthritis. The joint pain is real. The swelling is symmetrical. Blood work shows mild IF elevation. So she's put on methotrexate. But 8 months in, she starts feeling different. Not just joint pain now, but burning in her legs. Blurry vision in one eye. Brain fog that turns to full confusion. Her rheumatologist says, that's not RA. Maybe it's stress or menopause. A neurologist orders an MRI, comes back clean. No MS lesions. But no one checks her for Sjogrens. 2 years go by. She now has small fiber neuropathy, dry eyes, and autoimmune nerve damage, all missed, because her doctors thought RA explained everything. The reality of autoimmune overlap. Here's what you need to know. You can have RA and Sjogrens. You can have MS and Sjogrens. You can even have symptoms of all three, without fitting neatly into one box. This is called overlap syndrome, and it's not rare. In fact, according to data from multiple US rheumatology clinics, up to 30% of patients with one autoimmune disease have signs of another. But unless your doctor is looking for it, they'll miss it, and you'll suffer without knowing why your treatment isn't working. What changes when you know? When you get a full picture, when a doctor finally sees the overlap, it can change everything. Medications shift from single target to multisystem. You stop getting passed around between specialists who only treat their lane. And you finally understand why you're getting symptoms that don't make sense under just one label. If you've ever been told, your symptoms don't line up, or this doesn't fit your diagnosis, that's your cue. You may be living with overlap, and that's the key to finally getting real help. If this sounds like your story, type double trouble in the comments. I'll send you a private link to a full overlap tracking guide, so you can document your symptoms in a way that makes it impossible to ignore. Up next, let's talk about how your body starts warning you when these diseases shift from mild to dangerous, especially when the nervous system is under attack. So here's the turning point most people miss. When your immune system shifts from attacking your joints or glands to targeting your nervous system, your body doesn't whisper. It screams. But if you don't know how to listen to those early warnings, you end up in an ER at 2 a.m. thinking you're having a stroke, only to be sent home with nothing. Story: the stroke that wasn't. A 46-year-old man from North Carolina walks into the ER. He's slurring his words. His left side feels numb. He's dizzy, nauseous, and sweating. They run a CT. It's not a stroke. His heart's fine. But he's got a history of IA. He's never been screened for Sjogrens or MS. He gets told it's probably a panic attack. No MRI. No nerve testing. No referral. Just sent home. Within 6 months, he's got foot drop, burning nerves, and a spinal tap that shows inflammation, but no clear answer. What he actually had was autoimmune brainstem involvement. The damage? Already done. The real neurological red flags. Here's what to watch for, especially if your scans are normal but your body isn't. Sudden imbalance or walking like you're drunk. Limb weakness that comes and goes. Buzzing, tingling, or stabbing pain in feet or hands. Blurry or double vision that resolves on its own. Cognitive changes, word-finding trouble, brain fog, irritability. Increased heart rate or dizziness on standing, autonomic nerve damage. Electrical zaps in your spine, especially with neck movement. These aren't random. They're your nervous system glitching, and they can come from MS, Sjogren's, or even eye-related vasculitis in rare cases. But here's the issue in the US, unless your MRI shows major lesions, many doctors will dismiss these symptoms as anxiety or stress. What this means for you. If you've been told you're fine but you don't feel fine, don't stop. Because this is how permanent damage begins. Nerves don't heal easily. Early treatment matters. And misdiagnosis is common. You need to push for the right workup. Brain and spinal MRI with contrast. Skin biopsy for small fiber neuropathy. Autoimmune blood panel, SSA, SSB, ANA, CRP, AUF, anti-ccp. Tilt table test or HRV monitoring for autonomic issues. Spinal tap if MS is suspected but not visible on scans. If you've had any of these symptoms and were told it was just stress, comment neuro damage below. I'll reply with a step-by-step checklist you can literally print and take to your doctor. And coming next, let's look at the lifestyle triggers making your symptoms worse behind the scenes. Foods, meds, habits, especially if your nerves are already under autoimmune attack. At this point, you might be thinking, if this is autoimmune and it's in my nerves, what else is making it worse? And the answer is, your everyday life. From what you eat to what you take to how you sleep, every single choice can either calm your immune system, or make it more aggressive. What's quietly fueling the damage? Here are 5 everyday things that make nerve symptoms and autoimmune inflammation worse, especially in people with Sjogren's, RA, or MS. 1. Artificial sweeteners and acidic drinks. Diet soda, flavored water, and even sugar-free gum can dry out your mouth, irritate salivary glands, and worsen burning tongue or dry eye. Aspartame and sucralose are especially triggering for Sjogren's. They've also been linked to gut dysbiosis and immune activation. 2. Anticholinergic medications. These are common over-the-counter drugs, like Benadryl, PM sleep aids, some antidepressants, bladder meds, and IBS treatments. They dry up fluids, which might sound helpful for allergies, but they also worsen Sjogren's symptoms, raise dementia risk, and interfere with autonomic nerve signals. If you're taking anything for sleep, allergies, or bladder urgency, double-check it. This class of drugs is one of the worst hidden triggers for autoimmune nerve flare-ups. 3. Ultra-processed foods and seed oils. Anything made with canola, soybean, corn, or safflower oil can increase inflammation, especially in RA. These oils get oxidized easily, leading to joint pain, nerve swelling, and immune overreaction. Combine that with processed carbs and you've just built the perfect storm for flare-ups. 4. Poor sleep timing. It's not just how long you sleep, it's when you sleep. People with autoimmune disease who stay up past midnight consistently have higher inflammatory markers. Why? Because your nervous system does most of its repair work between 10 p.m. and 2 a.m. If you're scrolling at 1 a.m., your nerves aren't healing. They're breaking down. 5. Magnesium and B12 deficiencies. These two are critical for nerve conduction and muscle function. But here's what most people don't know. MS patients often have low B12 absorption. Sjogren's patients frequently lose B12 due to intestinal damage. RA patients can become magnesium deficient from inflammation and meds. Low levels of either can mimic or worsen nerve symptoms. A simple serum B12 and magnesium RBC test can reveal what's missing. These are all things you can control, even if your diagnosis is still unclear. If you want my full daily checklist of foods, supplements, meds, and habits to reduce nerve inflammation, just comment Daily Fix below and I'll send it straight to you. Up next, we're going into real recovery stories, what actually helped people in the US stabilize their symptoms, reduce nerve pain, and finally get answers after years of misdiagnosis. Let's shift gears for a moment, because by now, you've probably seen pieces of yourself in all of this. But instead of drowning in fear or confusion, let me show you what it looks like when things finally start to click into place. These are real people, from across the US, who went through years of misdiagnosis, and finally broke through the wall. Story 1. The woman who was told it was just fibromyalgia. Jennifer, age 41, from Arizona. She was told for 5 years that her symptoms were just fibromyalgia and depression. Burning feet. Brain fog. Crushing fatigue. Constant sinus infections. Rheumatologist ran an ANA, it was negative. So they dropped it. But one night, after another ER visit where her heart rate spiked to 130 while lying down, she Googled one phrase. Burning feet, dry mouth, nerve pain, fatigue. That led her to Sjogren Syndrome. She asked her doctor to test SSA and do a lip biopsy. Both were positive. She had small fiber neuropathy, autonomic dysfunction, and full-blown neurosjogrens the entire time. Today, she's on immunotherapy, takes magnesium, uses prescription eye drops, and sleeps upright. She's not cured, but she's stable, functioning, and validated. Story 2. The man misdiagnosed with MS. Marcus, 38, from Chicago. He started with tingling fingers, fatigue, and occasional double vision. His MRI showed tiny spots, but not enough to confirm MS. 2 neurologists gave him a wait-and-see plan. He noticed dry mouth, jaw pain, and sinus pressure, but thought it was allergies. His wife pushed for more testing. Eventually, a rheumatologist ordered an SSA panel and a skin biopsy. The results? Sjogren's with neurological complications. He was misdiagnosed with early MS for 2 years, and the treatments he got weren't helping. Once he got the right label, he switched meds, adjusted diet, and started B12 shots. He now walks 2 miles a day, runs a small business from home, and says, getting the diagnosis didn't fix everything. But it gave me a map. Story 3. The one who had both RA and Sjogren's. Dana, 56, from Texas. She had textbook RA, morning stiffness, symmetrical swelling, positive RF. But the dry mouth and nerve burning didn't respond to RA meds. Her rheumatologist said, that's not part of RA. She got a second opinion and was told, you might have an overlap. That new doctor ordered SSB, lip biopsy, and skin punch testing. She had both, RA and Sjogren's. Her new treatment plan included methotrexate, pilocarpine for dryness, and IVIG for nerve damage. The brain fog lifted within weeks. The common thread in all 3 stories? They didn't stop when the blood work said normal. They pushed through dismissal. They documented symptoms, asked for the right tests, and connected the dots themselves. If any of this feels familiar, don't wait for someone to give you permission to investigate. If you've been dismissed or misdiagnosed, and you're still searching for answers, type MY story in the comments. I'll heart your comment and reply with a private symptom tracker and diagnostic checklist, built from stories like these. Coming up next, I'll show you exactly what to bring to your doctor to finally get traction, phrases, printouts, lab names, and how to avoid getting ignored again. What to bring to your next doctor appointment. Let's talk about that next appointment. You know, the one where you've waited weeks to see someone, you've rehearsed everything in your head, and then, the visit lasts 10 minutes. You get told your labs look fine, and they suggest you keep an eye on it. That cycle ends now. If you want real answers, especially for something complex like RA, MS, or Sjogren's, you can't just show up and hope they take you seriously. You've got to go in with a plan. First, bring your symptoms, on paper. Not just in your head. Not just, I've been tired lately. Write it down. Say what hurts, where, and when. For example, my hands are stiff every morning for about an hour, or my feet burn at night even when I'm not walking. The more specific you are, the harder it is to be brushed off. Patterns matter. Doctors take data seriously when it's laid out clearly. Second, you ask for the right tests. Don't wait for them to offer. You walk in and say this. I've been dealing with symptoms that could be autoimmune, fatigue, joint pain, nerve issues. I'd like to test for conditions like RA, Sjogren's, or MS. Can we run a few labs to help figure this out? Then you hand them a written list. It should include SSA, SSB, ANA, CRP, ESR, rheumatoid factor, anti-ccp, B12, magnesium, and thyroid levels. That's not too much to ask. Those are standard labs for autoimmune screening. If your symptoms involve balance, vision changes, brain fog, or weird nerve pain, say this. I'd also like to do an MRI of the brain and spine with contrast. I've read that nerve symptoms can show up before anything appears on blood work, and I don't want to miss anything. And if they hesitate? Keep it calm, but firm. I've already done the basics. I'm still getting worse. If this isn't something you normally handle, I'd really appreciate a referral to a neurologist or rheumatologist. Then before you leave, ask this one question, because it locks the visit in. Can you go over what we are testing today, and what the next steps would be if everything comes back normal? That question tells them you're organized, paying attention, and not going away quietly. If you want a done-for-you printout with everything I just said, symptom tracker, test request list, and those exact phrases you can hand to your doctor, just type diagnosis plan in the comments. I'll reply with the link personally. Next, I'll walk you through the final scorecard, the clearest way to compare RA, MS, and Sjogren symptoms side by side so you can finally get clarity. Alright. Let's pull it all together. You've heard the symptoms. You've seen how these three diseases overlap. But now you're probably wondering, which one actually matches me? So let's walk through it, one by one, the way I would explain it if we were sitting in a room together. No fluff. No checklist. Just real talk. If what you've been dealing with is joint stiffness, especially in the mornings, like your hands or knees locking up before you even get out of bed, and if that stiffness is happening on both sides of your body, that's one of the first big clues we are dealing with rheumatoid arthritis. I usually starts in the smaller joints, your fingers, your wrists, maybe your feet, and it tends to hit symmetrically. That means both hands hurt, not just one. If they are swollen, warm, or visibly inflamed, that's another giveaway. You might also feel wiped out during flare-ups. Now, eye doesn't usually mess with your nerves in the early stages. And dryness? That might show up later, but it's not the main event. Now, if instead you're noticing strange nerve symptoms, like tingling, numbness that sticks to one side, or that weird electric zap feeling when you bend your neck down, that's when we start thinking about multiple sclerosis. MS usually begins with sensory issues. You might have blurry vision in one eye, or pain when you move your eyes. You could start tripping more, dragging a foot, or feeling off balance even though your strength seems fine. And the fatigue? It's intense, out of nowhere, like someone pulled your plug. Add in some brain fog, maybe trouble finding words, and you're in MS territory. Especially if an MRI shows white spots or lesions on your brain or spine. That's the pattern doctors look for. Now let's talk about Sjogren's, the most misunderstood of the three. This one's tricky. Because while IA hits your joints and MS hits your nerves, Sjogren's can hit everything, silently. If your mouth feels dry no matter how much water you drink, if your tongue burns, if you've had multiple cavities even though you take care of your teeth, that's not just dehydration. That's your salivary glands shutting down. Now, combine that with nerve symptoms that don't show up on a scan, like burning feet, buzzing sensations, or a racing heart when you stand up, and we are dealing with something deeper. Especially if your brain feels foggy, your focus is gone, and you're told it's just stress. What makes Sjogren's unique is that it often shows up with normal imaging. You can have nerve damage without any proof on an MRI. That's why so many people get stuck. The tests don't match how bad they feel. And here's the twist, Sjogren's can show up with RA. Or even with MS-like symptoms. That's why so many people are misdiagnosed for years, because they don't fit neatly into one label. So if you're listening to all this and thinking, wait, I have some of this, but also that, and maybe even that other one. That's not weird. That's the overlap. It's common. And honestly, it's one of the main reasons people go undiagnosed in the US for so long. The good news? Now you see it. And once you see it, you can't unsee it. You know what questions to ask. What tests to request. What patterns to look for. If you want a simple, printable version of everything I just broke down, something you can bring to your doctor, screenshot on your phone, or keep for reference, just type Scorecard in the comments and I'll reply with the link. And if your brain symptoms or nerve pain have been getting worse at night, especially if doctors say your scans are clean, you need to watch my next video. It's all about how Sjogren's attacks the brain and spinal cord, and why most neurologists miss it. I'll link it right here on screen. You don't want to miss that one. It could explain everything. Alright, if you've made it to the end of this, you're already way ahead of where most people ever get. Because now, you know more about RA, MS, and Sjogrens than most general doctors will ever explain in a single appointment. But if you're still feeling like something's off, like your symptoms don't fully match anything you've been told, there's one more piece you can't skip. It's what happens when your immune system starts attacking your brainstem and spinal cord, at night. When nobody's watching. The twitching. The zaps. The panic. The sudden weakness that disappears by morning. That's what the next video breaks down, in full detail. So if your symptoms get worse at night, if you've been told it's anxiety, or if your scans are normal but you know something's not right, click on that next video. It might finally explain what nobody else has.